Welcome, everyone. As we wait for more participants to join us, please let us know in the chat where you're from. Just tell us the country, tell us the city, tell us the town. I am Kim Sawyer from the Pulitzer Center, and I'm glad you all are joining us today as we zero in on the disparities of healthcare and social services in this age of coronavirus. Our session is part of the Pulitzer Center's Focus on Justice online series. We believe it is critical, especially at this moment in our history, to keep issues of justice at the forefront of our reporting and our conversations. There are now more than 3.9 million confirmed cases of coronavirus in the US. The number of deaths has risen to over 143,000. It is people of color and those who are marginalized who are most seriously impacted. How has this occurred? Why is this happening? We will be discussing today. And people are not telling us where they're from, although we do have someone from Arkansas, but don't hesitate to let us know where you're listening. For those who are joining us for the first time, the Pulitzer Center is a nonprofit journalism and education organization based in Washington, D.C., supporting more than 170 reporting projects each year on global and local issues. A few of the themes we focus on include racial justice, women's economic empowerment, Indigenous communities, environment and climate change, migration, and COVID-19. You will find all of these stories on our website. We've developed a strong university program providing opportunities for journalists to connect to college students in person and now virtually. On the K-12 education front, we reach thousands of students and educators via class visits, online sessions, and professional development workshops. The reporting and education resources are on our website at pulitzercenter.org. And I now see that we have people joining us from Madison, Wisconsin, Seattle, Washington, Cambridge, Maryland, Las Vegas, and many more places. We'll start the conversation hearing from our guests, Claire Galofaro, Aisha Sultan, and Eric Adelson. And then we'll have time for questions from the audience. You'll see a Q&A icon on your screen. You can begin adding your questions at any time throughout the remarks. So please do go ahead and do that. We love questions. There's also a chat icon on your screen. We'd appreciate it if you'd use the chat icon for specific technology issues. Note that all attendees are muted, but if you cannot hear us, let us know via the chat box. We also want to let you know that we are recording this session to post it online for others who could not join today. And if you would like to tweet, please use the hashtag #JusticeFocus. Thank you. One final logistic note, please remember to stay online once this session ends for an online, very brief survey. And now I'd like to introduce you to our speakers for today. Claire Galofaro is a correspondent in Louisville, Kentucky. She was awarded the Livingston Award for Young Journalists in 2017 for her reporting on Appalachia after the collapse of the coal industry. Her stories for the Associated Press have explored the opioid epidemic and also how despair in small-town America gave way to the rise of President Trump. In 2020, Claire started to focus her attention on the impact of the COVID-19 pandemic on rural America. Claire has a master's in journalism from Syracuse University, our partner school. Aisha Sultan is a nationally syndicated newspaper columnist and award-winning filmmaker. Her work has run in more than 100 publications, including The Atlantic, The Wall Street Journal, and The Washington Post. Aisha explores social change with an emphasis on education, families, and inequality. She's won several national honors, including the Asian American Journalists Association Award for Excellence in Print Journalism. Aisha teaches college writing at Washington University in St. Louis. She's a graduate of the Knight Wallace Fellowship at the University of Michigan. And Eric Adelson comes to us from Orlando, Florida, where he teaches at the University of Florida. He wrote for ESPN magazine for 10 years and then Yahoo Sports for 9. He focuses on the intersection of sports and society, and he won the Associated Press Sports Edition 2013 contest in feature writing. He is the author of The Sure Thing, about the early career of golfer Michelle Wie. Today, he will talk about the hidden homeless. How do you keep a safe distance when you have no control over your living situation? How do you stay home when there's no home? Let's begin with Claire, who has reported on the impact of COVID-19 on rural America, focusing on Dawson, Georgia. Go ahead, Claire. Thank you very much for being with us.
Well, thank you so much for having me, and thank you to the Pulitzer Center for the support on telling these stories. I've been covering rural America for years, and when it became clear that coronavirus was this extraordinary threat that our country was facing, I started hearing from people who work in rural medicine panicked, and they said, we are not ready for this. There are places in this country where people live an hour's drive just from a doctor. Rural hospitals have been closing by the dozens. What if, these doctors in rural parts of the country were asking, what if this virus seeps into thas communities? At the AP, we've been really tracking how the virus is spreading around the country. And if you look at it by case number and case rate, it is early on, it was in pretty predictable places, the places that you would imagine, New York City, New Jersey. But if you looked at it differently, if you looked at it where it was killing the most people per population, one area really stood out, and that is this rural, poor, predominantly Black community in Southwest Georgia. Holly, I don't know if you want to maybe put up some photos now, just so people can get a sense of this area. When we first started trying to figure out what was happening here, the first person I talked to was a reverend there named Ezekiel Hawley. He runs this small communities NAACP. And what he said was that, when he first started hearing about the virus, he thought, it's a virus, it will be indiscriminate. And then he opened the newspaper and was reading the obituaries. And, this is a small town. He knew every person. He knew their mothers and their fathers and children. And he thought, why is this virus killing more people of color and killing poor people more than anyone else? Tell me that. And I think that is the question that we are now facing as a country. A lot of people in these rural communities all funnel into one hospital. And that hospital was absolutely flooded by people who were sick and dying from coronavirus at extraordinarily high rates. And an emergency room doctor there who has worked in his community for years, he's from there. He lost some of his friends and his neighbors to this disease. And he said, right now, they're just sort of searching for ventilators, searching for bed space, searching for helicopters to fly people to other hospitals that might have room. It is crisis mode, but that will end. And then the responsibility will be to reflect on how this happened, how this place became so vulnerable, how all of these sort of predictable, known problems created this sort of perfect constellation of inequalities that made these people die so quickly from coronavirus. And he said that that is what, you know, history in the end is really going to judge us for, whether we look at those problems, look at those inequalities, and make the decision now that we must fix them. And so I'm happy to answer any questions later about this story or about what some people think the solutions are. And I'll kick it back over to Kim. Thanks so much.
Oops. You're muted, Kim.
Sorry about that. I told everyone not to mute. And I did. Okay. Well, I now want to turn it over to Aisha, and we'd like to hear from you. Tell us the story behind the 63106 zip code.
So in St. Louis, there is a zip code 63106 that's the most underserved zip code with high rates of health inequality, income inequality, unemployment, and disparities, racial wealth disparities, and it is in the entire metro region. And so the story that I did and that the Pulitzer Center is supporting us to do is to focus on people who live in this zip code and how the pandemic is affecting them and their lives. And we've been focusing and writing profiles on people in all different kinds of situations. Since my stories tend to focus on families, and I am writing about and following a single mom with 2 young kids, and I believe we have some photos of Tyra and her children, Miguel and Madison. There she is, and she was, when I first met her, she was pregnant, and her 6-year-old son and 5-year-old daughter had been, like most children, told not to come back after spring break to school and switch to virtual learning. And the story that I wanted to focus on is, how do you homeschool when home is not safe? So children in St. Louis City have been killed at 10 times the national rate for decades, according to analysis that's been done by my newspaper, the St. Louis Post-Dispatch. The child homicide rate in St. Louis towers over that of similar cities. It's quadruple over Indianapolis and Kansas City, triple the rate of Milwaukee, and double the rate of Baltimore. Not only that, and Tyra would tell me there were times when she would hear gunshots right outside her complex, or right outside her window. And within an hour, she would pack up her kids, grab some clothes, and head across the river to her mom's house into Illinois. Or sometimes she would go to her sister's house in a different part of town. And she did this while maintaining a very strict schedule of homeschooling she created for her young children, like minute by minute. This is a devoted mom who was terrified of her kids falling behind, despite the challenges that come with systemic racism and poverty in this area that make, overcoming that and succeeding in the educational system really challenging. Not only is the issue of violence and health disparities in this area, Missouri has a really high maternal mortality rate. Women in Missouri die at a higher rate when they're pregnant, and Missouri Black women have nearly 3 times the maternal mortality rate of white women in our state. Black babies in St. Louis are at greatest risk of dying after they're born. So I wanted to follow Tyra's story to see how she fared through her pregnancy, especially when she couldn't get to a hospital or get prenatal care or access it because of the virus. And I'm happy to report that she has had her baby, and mom and baby are healthy. They're all staying at her mom's house. Sorry, someone just walked into our house. And, but I will be following them for this school year and reporting on what that's like, and trying to keep up with educating kids, little kids, by yourself in a situation like this. Sorry about that.
Thank you, Aisha. Let's turn now to Eric Adelson. Can you tell us about the hidden homeless? Who are they and where are they?
Thank you, Kim, and it's really an honor to be on this panel with Aisha and Claire. I really admire the work you've already done and continue to do on important stories. I came to the topic of student homelessness in 2018 My world is sports writing, and I found a high school student in rural Michigan who looked like the homecoming king. He was tall, dark, and handsome, and extremely popular, and very good at multiple sports, and a good student. His name is Ethan. Thank you, Holly, for putting the picture of him and his mom on the left had passed. That's Ethan when he was a little boy, and in the interim, and mom had passed away. And Ethan was homeless, and almost nobody at the school knew about that. And when I learned his story and told his story, I realized how pervasive student homelessness really is in this country. And it was a crisis even before this year. In 2016, there were 100,000 homeless students experiencing homelessness for the first time in American history. For these students and for these families, the Great Recession of 2008 and 2009 never ended. And so when the coronavirus hit, one of my first thoughts was wondering about students experiencing homelessness who now have to stay at home when there's no home to stay. And so I did my first Pulitzer Center story in Detroit. This was, as many of you know, one of the central places of outbreak when the coronavirus hit. And teachers were on Zoom crying in tears, unable to find their students, know where they were, unable to go find them, unable to reach out to them and see if they had the support they needed. And so my first story was about the chase for trying to find them, locate them, help them as much as possible without actually going to where they were. You can't go to a bus station, it's unsafe. You can't go to a shelter, it's unsafe. You can't go to a hotel, it's unsafe. So where do you go? And so my first story was about trying to find them on the teacher side. And then today I was in Jacksonville. I live in Orlando, Florida. This morning I was in Jacksonville, Florida, speaking to a family, a single mom and two kids, much like Aisha's story. And the mother lives in the shelter, has to stay in one room all day with her two kids, can't go outside because if you're with other people, you're more at risk. You can't practice social distancing in a shelter. You have to stay in one room. And so she has to go look for work, and she did find a job just recently at a local grocery store. But now school is starting again, and she has to choose, do I put my kids back in face-to-face learning, or do I keep them home? And what do I do about my job that I just found? So these are the unique, very difficult, painstaking challenges for homeless people, most of which are people of color, but not all, trying to figure out how to navigate a world where there's truly no safe place. And Florida, where I live, has a unique situation because there's still not complete recovery from hurricanes, Maria and Irma and Michael, that hit all varying parts of the state. And so there's not only been a spike of student homelessness from the Great Recession, there was another spike in student homelessness in Florida from the hurricanes. And so now that we've finally started to come around from that, we have the coronavirus crisis and the start of hurricane season. And I really don't know what people will try to do if there is a hurricane anywhere in Florida, because you can't go to a shelter, you can't stay where you are. It's hard enough to do that now. And you see these charts, thank you, Holly, for putting that up. If you're not in school, you're more at risk, not only for academic failure, but also for abuse, for trafficking, for drug use, and obviously for delinquency. The student I spoke to today, very bright kid, actually was labeled as gifted. Now 11 years old, loves science. He was talking to me about woolly mammoths and how much he can't wait to get back to learn science. But he confessed to me that when virtual learning started, he couldn't keep up and he started to fail. So he wants to go back to school, but his mom doesn't want to risk it. And that's one of the many, many, many dilemmas that are facing homeless parents and kids all over the state and all over the country.
Thank you, Eric. And thank you, all three of you. You're telling such important stories. We want to now invite all of you to ask questions. Please do put your questions in the chat. Very much would appreciate hearing from you there. And actually, I made a mistake. Please put them in the Q&A. But now I want to start with a question for Claire. Claire, in your video, you interviewed Dr. James Black, and you already told us a little bit about what he said. It's one of my favorite parts of your story. This is the medical director of emergency services at Phoebe Putney in Dawson. And I'll just repeat it again because it's gives us all something to think about. History will judge us not only by how well we prepared and how we responded, but also by what we learned and what we changed moving forward. So could you tell us, Claire, in a nutshell, what have we learned from what has occurred in the last few months?
Well, I think that what people like Dr. Black have learned, who have seen this up close and very, very personally, is that we have known this all along. You know, this part of Georgia, you know, people that live here are twice as likely to have conditions like diabetes than people just a couple hours down the road in Atlanta. And so what the coronavirus has revealed to us, I think, is that there are these deep and stark inequalities in healthcare and how people have access to healthcare, healthcare coverage, healthcare facilities, but also economic issues that make, you know, people have jobs that are not conducive to social distancing. You know, a lot of people can just stay home, but a lot of people can't. And so Dr. Black's point there was that we have to look at this and we have to see it and we have to figure out a path forward so that the poorest and most vulnerable among us don't continue to die disproportionately from this disease.
Okay, thank you. And Aisha, I'm going to ask you a question, and then I'll ask Eric a question, and then we really do want to hear from the audience. Aisha, the 6310 zip code of St. Louis has 6 times the unemployment rate compared to the neighboring city of Clayton, which for those of you who don't know St. Louis is just around the corner. It has 8 times the poverty rate and 1/4 the median income. What can we do to change this disparity?
Well, I mean, there have been a lot of projects around the country over time that have looked at how do you help areas of concentrated poverty and that have high rates of unemployment or underemployment. Like, what types of resources can we channel into there? But I think one thing when you're talking about kids is that type of investment and intervention has to start when mothers are pregnant. It has to start, you know, with prenatal care, with access to nutrition, with teaching skills that help children before they even get to school, you know? And so I think that that's a key piece of how you address generational poverty in areas that do have such structural, huge problems. And you can look at studies that show that investment in early education has one of the highest rates of return on any investment and spending on social programs that our country can do. So I'm a big believer, and I think the data and research bear this out, that early investment in children and families pays long-term dividends. And if there are people who, because of lack of access to healthcare, because of lack of expansion of Medicaid, cannot get prenatal care or prenatal vitamins, their children cannot get immunized or cannot have access to the same screenings that children do, then it's really difficult to make up that deficit later. Like once a child is 3 years old and has a 10,000 word vocabulary deficit, you're gonna have a really hard time bridging that gap later on, let alone when people are adults and have already been traumatized through a subpar education system, if that's what they're getting. So to me, that's a really key part of the solution.
Thanks, Aisha. Thanks. And Eric, a question for you. In your story for the Detroit Free Press, you wrote, I think the major takeaway is that school is shelter for these kids. And there's a sort of paralyzed chaos when there is no school. Teachers and allies scramble and fret all summer during this pandemic. But ultimately, there is no safe place for homeless students. I think this is more relevant than ever with the ongoing debate about whether to open schools. And my question for you, Eric, is how do we encourage more teachers to help students or to do what Margaret Lee in your story has done?
Well, I think that the teachers need help. I think that the teachers are fully committed to doing whatever they can for the students. I mean, teachers all over the country, in a lot of cases, are risking their own health to get back into the school. But I think that when you report on the stories that Claire and Aisha and I have reported on, you realize that social distancing is a privilege, that's something that the rest of us can do by choice. But a lot of people don't have the choice to social distance. And when you're in that situation, then what do you do? And I think that there's no real easy answer, but I was struck by what Aisha said about early learning, because every month out of school is several months in terms of the gap, because you have privileged children who are able to learn, read, get ahead, and let alone just concentrate, just be in a place that's quiet and be able to have the mental privacy to look at the screen and not worry about what's behind them on the in the place where they are, or the noises around them, or when the next meal is coming, or how hungry I am and I just want to eat something. This all gets in the way of learning. And so I'm a teacher myself, and so I guess I'm biased, but my heart breaks for teachers who are in this situation, that they feel their students slipping behind and behind and behind. And I think it's a mistake to sort of think that they were behind anyway. Not necessarily. The students that I spoke to for the Free Press story and for this story, they're good students. They're eager. They want to be back in school. But when there's literal chaos around you, or when there's no air conditioning, or when you're worried about your safety, or you're tired. One of the kids that I talked to today was falling asleep during the interview. It was heartbreaking that he just wanted to be in a comfortable place so he could doze off. How do you learn effectively when you're in that situation? So I don't know. I have ideas for solutions. I'm sure we'll get into that, or at least options. But you have to keep in mind, I think, that people are tired, physically tired, and that adds to the challenge.
Okay, thank you. It's like being physically tired and being hungry to Karen. We're going to start now with audience questions, and we do have one from Solomon Leash. This is for Aisha. Aisha, how did you find the family you're profiling? You're muted there.
Great question. Because I'm working as part of a team, and a former editor of mine at the Post-Dispatch assembled us, what he did is he identified through people who provide social services in this area and nonprofit, like non-governmental organizations that provide services, charter schools. And he sort of did a pre-screening with families to say, okay, we want to have a reporter talk to you and develop a relationship with you for a longer period of time. And so then he sort of sent me like 5 different candidates that he had screened. And actually I went through a process of trying to talk to 2 or 3 of them, but you know, people have a lot going on in their lives right now, and sometimes talking to a reporter is not their top priority, understandably so. And so depending on who I could hear back from in a timely fashion, who was able to understand what it meant to like share personal difficult details of their life, and to, I spent a lot of time explaining to people that anonymous people on the internet will read your story and make judgments about you and make comments about you that are going to be rude and vicious and sometimes hurtful. So are you okay with that? And I give people a chance to really think about that. And if you're not a public person or you're not a politician and you're just living your life and struggling to get by, I feel like we have to be extra careful about that disclosure, about how people, especially a single mom having another child. I mean, you can just imagine the type of things that will be said on the internet about her. And so anyway, so it's kind of like a process of going through the people who had been referred to me by my editor, who's corralling all of us reporters that are working on this, and then finding the person who I felt like was on board, understood the implications of being involved, would give me access, who I could contact, and who at some point would be okay when it felt safe to both of us, me showing up and just spending a lot of time with them. I haven't done that in person yet. All of my reporting has been over the phone or through Zoom, because Tyra, the woman whose family I've been interviewing, is extremely scared of the virus. She's terrified of getting sick. I mean, her kids had not left the house at all. They had not left the insides of their home or their grandmother's home or their aunt's home for like 3 months. They had not played outside. And as a mother of kids, just that idea of these 2 little kids not even getting to play outside because their mom is so scared. I was like, can they go in the backyard? She's like, no. She was so terrified of them getting sick because she knew if they got sick or she got sick, there was no backup. You know, it was survival. So, so obviously I completely respect that. But when she feels safer or when the kids are back in school, then I definitely want to go see them and just be able to report that way too.
Okay, thank you, Aisha. Thanks. We have a question from Anne Oldenburg, and I think this is for all of you, although Aisha, you just partially answered it. How are all of you physically reporting these stories? Are you going out into the community and physically talking to people? So maybe we should let Claire and Eric answer that.
Sure, I'd be happy to talk about that. It's something I've spent a lot of time as a journalist thinking through. It is a very careful calculation of, you know, risk and worth. You know, what value can we get in the fields that we could not get over the phone? For this particular story, we did go and meet people in person. We were very obviously careful about social distancing and wearing the appropriate masks and other PPE. You know, for whatever situation we were walking into, whatever was appropriate, and being very clear with the people we were interviewing about what their comfort level was, what sort of place they felt comfortable reporting in. So, you know, we have been reporting in the fields for big, important stories that need to be told, and that you need to look at someone's face, and that it's important for our readers to be able to look into their eyes to understand what this journey is like for them. But it is a very, very careful calculation of how we do that, how we keep ourselves safe, and more importantly, I think how we keep, you know, of course, our worst fear is to go into a marginalized community and make things worse, you know, and so that has been the sort of gut-wrenching emotional part of this for me, and like what my responsibility is to keep myself safe so that I would never be in a situation to put people who are, you know, willing to tell their story because they think it's important at any kind of heightened risk just because I showed up. So I think that that is a really complicated calculation that, you know, I'm sure all newsrooms across America are making right now, and it is a hard one. It's not easy, and I think that it's something that we as an industry are going to be facing for a really long time as this virus, you know, continues to spread and continues to surge. So it's a tough one for sure.
Yeah, I agree with Claire, everything she said. You have to look someone in the eye. I mean, when I speak about anguish and fatigue, that's not visible on the phone. And so what I did, I met, Family Promise is the name of the center that's helping this homeless family. We met there, social distance, then some. I was across the room. I put my recorder halfway between myself and them. And then I just asked them to speak up, so my recorder got it. And then I was able to speak up so that my recorder got it. And then took some pictures at a distance. You know, just like what Claire said, you don't want to add to the problem. But again, it just shows, you know, I remember getting back into the car, and I was certainly nervous because I wanted to drive back here and meet with you guys. But just there's some relief to drive away because, you know, you're no longer posing any threat and you're no longer in that situation. That concern, that sort of unspoken fear is with them all the time. There is no hideaway from that. There is no respite from that. They are around each other, strangers, all the time. And of course, you know, when you and I go out shopping, everyone kind of knows the situation. But if you're in a homeless area, how much does the other person know? How much does the other person respect the rules? How much is the other person avoiding spreading something? So again, as nervous as we all are as a society, I think that the concern and fear is much higher. And so I think it helps me as a journalist to feel that even more than I do in my normal life.
I will say one thing that it has been really helpful to be able to FaceTime, because I agree, like, so much nonverbal communication, nonverbal communication says so much, not just in building trust with people who you're interviewing, but also for you as a witness, as a reporter, you need to be able to see certain things. Like I've asked Tyra to take me on a tour of the house on FaceTime. I've talked to her kids over FaceTime. I've seen different places that she's lived. And because I can text her first, I can say, hey, is this a good time? Or what are you doing right now? And we can kind of be in touch throughout the day in what ends up developing a relationship that feels more intimate than me just like showing up and then going away and then showing back up. And you know what I mean? So there develops this sort of comfort level. Like she texted me when she thought she was in labor to just tell me, you know, they were outside walking and what she was feeling and where she was going through and what she was planning on doing. And then she texted me when she was in the hospital, and I was on FaceTime and I got to see the baby after the baby was born and her mom was holding the baby. So I feel like had I tried to show up there, and also because I'm still working full time on other stuff, I wouldn't be able to just drop everything and drive, you know, 40, 30 minutes for where I am to be there in those moments. The fact that we have built a relationship where she can just like get me on the phone and show me what's happening in her life right then is also really valuable.
Okay. Thank you all. This is a question from Stephanie Zero, and it's also for all of you. How do the students experiencing homelessness, low-income families, and the students in rural areas find access to the internet to be able to participate in school? And you also might want to comment on the impact this educational disparity will have on the students. And it's to all three of you.
I'm always going to defer to the ladies.
Claire is unmuted. Do you have something?
You know, that was not a focus of our reporting on this particular story, but I do know that, I mean, access to broadband is an incredible challenge for students. I live in Kentucky, and I've reported a lot on Appalachia, and that is an incredible problem for Appalachian students because just because of the landscape. It is hard sometimes for people to have access to internet in their houses. I've heard stories of people going, you know, to the truck stop and doing their schoolwork in the parking lot. So is it a true and real problem facing students, particularly at this time? But I would guess that Eric has a lot more insight to that given his experience reporting on homeless students.
I will comment really quickly on what I've seen out of Missouri, that the latest report that I saw from the State Department of Education was about 22% of students did not have access to the internet in our state. And that kind of aligns with, if you look at the number of kids who are homeless or in high poverty situations. Actually, children who qualify for free and reduced lunch are actually much higher than that percentage. So school districts have made a huge effort to take a survey at spring break and now before school starts to find out, do you have access to devices? How many devices are in the house? Do you have access to internet? And the ones who don't, they are providing Chromebooks or devices for children, and also they're providing Wi-Fi hotspots that families can use to be able to access the internet. I was just thinking this morning, I mean, we have 2 teenagers and 2 adults in this house, and when we are all going to be on our personal home system at the same time, like they're doing classes online, I'm trying to do interviews, my husband's working, like I don't know what the speed will be like. I don't know how often the system will crash. And imagine if you're in a family where you're in a personal hotspot and 3 kids are trying to get on, or a parent is also trying to supervise. So it is a real challenge. The other thing that they found is because after spring break, when most schools did not go back in-person session, many districts were not very strict on grading. They said either your grade could only drop a certain percentage if you didn't do the work, or you wouldn't drop lower. So there was a certain percentage of students that just never logged in. And that's one thing that I want to look at district by district and across the state. Like what percentage of students just never logged in, not even once. And even those kids who had access, because I knew there weren't really stakes attached to it. And so then there's 3 months of learning in addition to the summer decline that are just gone. And so then when you compound that on entire fall semester, you're looking at almost like close to a year loss. I mean, students after Katrina who experienced homelessness and missed school because of that hurricane and displacement, it took 2 years, from what I've read recently, to recover that academic learning that was lost. So we are past that point of how much time was left out of school for those children that were displaced. So this is not going to be a quick fix with like summer school and trying to make things up. It's going to be a years-long project to bring, to close the gap and even to bring students back up to where they ought to be.
Yeah, I think one of the big takeaways I'll have from this whole era is how abysmal the leadership has been in this country compared to how inspiring some of the ingenuity has been in this country facing the same situation. There's a community college that has something called a learning lot, where they turn on the Wi-Fi in a building and then students can drive up and then just sit in their car and take advantage of the Wi-Fi in a parking lot. So that's a learning lot now, that's Wi-Fi. And it's depressing to think that that's your learning situation, but on the other hand, I really feel like more communities should be building outdoor learning facilities. That's what we did 100 and some years ago in the flu pandemic. A lot of students went outside, and it was safer out there. So I'm not sure. Maybe other people know why this isn't happening more often here. We have the ability to build outdoor learning centers, at least temporary ones. But that's the debate. How do you stay outside and still get shelter and still get learning? And if you're in a situation like the family that I talked to, very similar to Aisha's family, single mom and 2 kids, even if you have Wi-Fi and it's not like you can call the IT guy in the shelter, even if your Wi-Fi works, you're sitting right next to each other in a room and you have to talk and listen, and your brother, your sibling is next to you doing the same thing. That's not easy for learning either. So I must give a lot of credit to schools that have really tried to front run the IT need. In some cases, putting the technology in their own cars and delivering it to a shelter or a bus stop or a house or a hotel. The teachers and administrative staff have been amazing nationwide, and literally talking to each other on webinars weekly. How about this idea? How about this idea? Can we do this? Have you tried this? Have you tried Facebook? But then there's all sorts of barriers that you don't expect. If you're doing a learning lot, how do you get there if you don't have a car? If you're going to a bus stop, well, people don't want to go on the bus. They don't feel like it's safe to go on a bus, to go to a bus stop. You want to reach out to a student on Facebook to see how they're doing, but then that gives away that they're homeless, and that's not something you're supposed to do because of privacy laws. So for every bright idea, there's a dim reality that shadows the chances of getting through to the students and really helping them.
Thank you. And I like this idea of the learning lot. And maybe we just need to have so many learning lots that we make them accessible. Do you remember what state this was in?
Like a poor journalist, I don't have the details. However,
St. Louis Community College has done the same thing. I mean, I've written about that as well, where they have the learning lots in their community colleges, because they do have a lot of commuter students and access was a huge issue. So definitely for sure that's happening here. But I hate to tell you, the part of the reason why it hasn't been prioritized, because our state, which has insisted that, they're trying to push schools to reopen to in-person classrooms, has cut funding, because you're finding states with massive budgetary concerns and deficits because of the economy being in free fall. And so we've had significant K-12 cuts in state funding. At the same time, what schools are trying to do, figure out how to get meals and technology and access and learning to students in this environment. In addition, if you're opening, then you have to have disinfectant, you have to have masks, you have to have other things. Like, their spending needs have gone up while our state has cut money for schools.
I just wanted to jump in real quick. It's Robeson Community College. I believe they started it. So I was able to do a quick search. And then I have the link if anyone's interested. I'll put it in the chat. So if anyone wants to look at it more, it's right here.
Okay. And we have a question from Penny Ratcliffe. This is also for all three of you about advice for student journalists. Penny writes, I am faculty advisor for a student newspaper of a private New York City high school. Do you have any advice for young student journalists covering the COVID story in their community and in the wider city community?
I can go ahead. I'll start on that. Don't be shy. I mean, your chance is now. Don't wait in line. I'm a teacher of student journalists at the college level, and when this outbreak happened, I said, "Go report. Go now. Don't worry about, oh, I only do sports or I only cover football." Two of my students have been published in newspapers because they've covered COVID already. Just because it's something that there's a great need in journalism, and nobody's going to put you in the, again, I'm talking from a sports perspective. Nobody's going to put you in the junior department. No one's going to put you in the toy department because you're 18, 19 years old. If you have a compelling story to tell and you can get it and it's true and it's accurate and you have a mentor that can help you make connections, there's a need. So now's the time. I mean, if there's anything good about the world of journalism right now, it's young journalists can go and there's no limit and there's no reason to hesitate. So you have my full support and applause if your students want to go and find a story and report on it, because right now everything matters, and there's no reason not to think so.
I agree with Eric. I think it's wonderful that you're going to have your students reporting on this. I mean, at a time when local newspapers are declining, when we've lost reporters all across the country, we can never have enough people writing about this story of our lifetimes, right? Like maybe the most important story we'll ever tell. And so thank you for having your students join us in trying to tell that story. It's so important. What I always tell young journalists is that, you can look on the internet, you can look on social media, but nothing will ever compare to talking to actual people who are living this experience. I think the most important thing I remember when I was getting started, I was super scared to talk to real people, ask people questions. But I think that is the way to the truth. That is the way to understand the experiences, what it feels like to live through this time and your students will have a perspective that us old folks don't have, which is wonderful. They can probably connect with kids who are living through this in a way that me or Aisha or Eric never would be able to. So I think that's great. And thanks for what you do. And feel free to, if you ever want to connect your students with working journalists, I think I would be happy, and I'm sure anyone on this panel would be happy to talk with them.
One thing that I would add is that this is a great opportunity for young journalists to start looking at data and figuring out how to make data requests to really understand and break down science, because one thing that we've seen is there's plenty of adults who could use some remedial science and math education, basic literacy education. But I think that's really valuable for young journalists to start learning how to read scientific data and then how to translate it so that their peers understand it, how to debunk bad information in a compelling way that's based, be the fact checkers for your school. Find out how your community within the school is comparing to what other communities are doing. I think a lot of student journalists have access to information they don't realize, a wealth of information where you don't have to go that far out of your community to ask critical questions about why are we doing it this way? How do we compare to what other peer institutions or other institutions are doing? And then if your students are in a private, more privileged environment, to compare statistically how their lives have been impacted. Even there are charts, there are TikTok videos that they can make that really drive home to their audience disparity, inequality in a way that I am not as fluent or proficient or good at. And I think that whether they tell a Snapchat story or make a TikTok video, relaying important life-saving information or opening people's eyes to disparities, that is just as much journalism as a story that I might publish, in the St. Louis Post-Dispatch.
Well, we're running out of time now, but I wanted to just read a couple of comments from our participants. And then I'm going to ask each of you for a final takeaway for 30 seconds only. But before that, Ann Oldenburg wanted to say thank you for the detailed and heartfelt answers. And Abigail Mapes, I may be mispronouncing that, notes that a university in Houston is bringing outdoor learning to hold fall classes. So, and then Penny adds her thanks and thanks from her students as well. So let's see, Claire, do you have any parting words?
Sure. I think that, the problems with access to healthcare in rural communities is systematic and it's ingrained, and it will take the society's full might, the political will to solve it. But, some people have suggested that there are creative solutions in the interim until we fix it, that there are things we can do. One guy who runs this Association for Rural Hospitals in Georgia, he was driving around one day and trying to figure out what on earth do we do about this. And he had this idea that, he saw all these discount stores, Dollar General, Family Dollar, and he had this idea, what if we put telehealth clinics in these? He sent letters to all of these companies. He hasn't heard back, but it's just one in what I'm sure are a million ideas out there to try to bridge the gap until, and if we find a long-term solution as a country. And thank you so much again, Kim, for having me here today.
Thank you. And Aisha?
Well, and I can say this, I feel like on behalf of my colleagues on this panel too, is that sometimes these stories can feel very heavy and depressing and can give you a feeling of hopelessness because the problems are so big and structural. And sometimes it's hard to get people to care about when there's a lot of bad news. But I wanted to say this. After my first column ran about Tyra and her kids, as much as I was worried about negative backlash, there were lots of people who reached out to me who said, hey, I don't have much, but I'd like to send her $100, or I'd like to buy her kids these learning devices, or can I drop off some books? And I think it's also important to remember that there are a lot of people, like we're reminded in the news of people's selfishness, cravenness, all these things, but there are a lot of people, if you write a story that touches their heart or tell a story that touches their heart, they're gonna wanna try to help.
Thank you. Eric?
I just want to thank you, Kim. I want to thank the Pulitzer Center. I want to thank my distinguished colleagues on the panel for your insight and inspiring me further. I'm seeing a lot of questions about what can be done. And I have one idea, and it's my own personal bias, so forgive me. But I'm on the board of the National Diaper Bank Network, and 1 in 3 American families struggle to provide diapers for their kids. Aisha mentioned it a little bit before. If you want to put your kid into daycare, a lot of times you have to provide the diapers. And the early learning, a lot of that is about comfort and being socially comfortable with other people. And that comes back to diapers too. So if you want to do a little thing in your community, urban, rural, international, find a diaper bank because that actually allows some of the wheels to turn in a family, in a school, and in a job search. So I hope you guys forgive me, but I'm seeing that question in the Q&A, what can be done, what can be done? It's not that expensive to donate. And if your kids are growing out of diapers, find a bank nearby. So I hope you guys forgive me for that, but I think that it does answer the question, and I see it all the time. Even today, when I was at the shelter, I noticed that there were low on diapers. So it's everywhere, and it's pressing, and not many people know about it.
Great advice. Thank you. And thank you, Claire. Thank you, Aisha. Thank you, Eric, for all your conversation today. Thank you too to my colleagues at the Pulitzer Center, especially Ethan Ehrenhaft and Holly Peipenberg, our producers for this session. We'll be posting today's webinar on our website in the next few days. Please spread the word. Our thanks goes out to the Art for Justice Fund, which supports the Pulitzer Center's reporting and education outreach on mass incarceration and related justice issues. We're grateful to all our donors, foundations, and individuals alike for supporting our journalism and for bringing stories home, a special Pulitzer Center initiative that allows us to focus on both the personal and the global impact of local reporting. Please visit our donor page to learn more. The Pulitzer Center's reporting and education on mass incarceration and other issues does welcome support from all of you. So if you are so inclined, please go to our website and donate. Please do stay a few minutes longer. A brief survey will pop up once we officially end the session. We appreciate all of you joining us for today's talk. Our next session in our Focus on Justice series is Seeking Asylum in a Pandemic. It's set for Thursday, July 30th at 2 p.m. Maria Hinojosa and Ana Catherine Brigida have reported on the dire situation of asylum seekers on the US southern border in the midst of the pandemic. They'll be joined by Maria Zamudio, who has reported on how the military has failed veterans who have been deported. Do join us next week. Feel free to share this event information with your friends and colleagues. And thank you for being with us today. We hope to see you again soon. Goodbye for now.